the latest COVID variant being nicknamed Kraken XBB.1.5. CNET is using AI to write financial explainers nearly 75 times since November. ChatGPT can be used to detect early Alzheimer's. Companion piece to this is that people are using AI to pass the medical licensing entrance exam. The latest variant of COVID, or the newest version of AI, which will be more disruptive to you and the world. I'm Jack Wang, and as an Australian scientist and professor, I spend a lot of my time talking and thinking about science, technology, and education in my day job, and also in my spare time on my YouTube channel, Biolab Collective. Like everyone else in the world, I've started a podcast. These podcasts aren't designed to be explainers or science lessons, and in fact, you might hear us say it's not my area. Quite often, podcasts will explore all the weird and wonderful topics in science, tech, and education, and try to find a thread that binds them all. The crossover connections. All right, so you feeling comfortable?
Yeah, I'm good.
You're feeling good? All right,
Yeah.
so I mean, I do this all the time. I make all these videos, and I don't really do podcasting, but I've been invited to a lot of podcasts. It's not comfortable in the beginning, so hopefully it gets a little less awkward for you.
That's right.
Seat's all right, mic's not too in your
good
face.
here.
All
Yep.
the podcasts have these scary microphones in your face, but you know, you kind of feel pretty powerful behind it, right? It gives you the sense like this
Getting a
authority.
power trip right now.
Yeah, you get like a sense of authority. Hi everyone, welcome to Crossover Connections. This is episode 1 of our podcast. We talk about science, technology, and education, how everything is connected. Hopefully you've seen me on the channel before, but if it's your first time, my name is Jack Wang. I'm a scientist and microbiologist and professor based in Australia. And my co-host today is Amanda.
Hi, pleasure to be here, Jack. Thanks for having me on. My background is that I have a PhD in cell biology, and I currently work as a manager of clinical research.
Yeah, and a complete noob to podcast, although I'm a complete noob as well.
Absolute
Yeah.
newbie to podcasting.
But maybe to video as well, right? So
Yeah,
this
that's
is-
right.
For those of you who are listening in the audio format, we're filming everything and putting it on the YouTube channel as well. So this is the first time that we're doing this, and the motivation for why I'm starting a podcast, because I do have a full-time job. I'm an academic. Why am I doing this podcasting thing? There's not much money to be made, if any money to be made, right? I don't think any money's coming out of this. The reason I'm doing this is that it's a really useful professional development exercise, because last year I was invited to join a panel to talk about science to the general public, and it was in the context of kind of like a comedy show, and I was asked to be on that, and they were talking about science headlines like, well, it's obvious you should know that this jellyfish was found doing this strange thing, and I'm like, I don't know any of this. And it was a game, and my team lost, obviously, because I didn't know anything. My area of expertise is microbiology, which is like a pretty specific niche, it turns out. I didn't think it was, but apparently it is. And I left that feeling just really dumb, like, hey, I don't know anything about that much outside of what I work on, you know.
Look, I think, to be fair, it would be every scientist's worst nightmare.
No, you think so? Yeah.
To be honest, yeah.
Well, there was another scientist on the panel. I don't want to throw her under the bus. I think she did really well.
Oh,
I
okay,
think she did
Yeah.
better than I did, but she was also breathing a sigh of relief when it's done, because, you know, we don't want to be exposed, right? I don't know anything.
That's right.
Yeah. So look, the format of the show is we're going to go through, hopefully do this a couple of times a month, and we'll look at the latest science headlines that are grabbing our attention and are seeming to gain some traction in the mainstream media. And we're just going to talk about it, look at it, see how it's presented. We're not looking at the pure primary research article. We're not looking at graphs, figures. We're purely looking at what the media has decided is a good way of presenting this information to the general public. And hopefully that filter they put on it is one that is positive, is accurate, is relatable, but also maybe it's easy for us to understand how it's connected to our work. And it's not just about our areas of science. So Amanda, your area is cell biology. So,
Yeah, that's right. Yeah.
okay, so for those of you that don't know, cell biology is applicable to almost everything, and it overlaps with other disciplines like biochemistry,
That's right.
molecular
Molecular
biology,
biology.
genetics, it's bioinformatics as well. And microbiologists like to think we're the center of the universe. So microbiology is, of course, connected to every of these biological disciplines. So hopefully there's enough there for us to look at and talk about in the realm of science. But yeah, anything to do with technology and education and those overlapping themes is kind of the focus of what we like to talk about. So onto the first headline is an article posted on The Conversation, although it's not hard to find. And it is, of course, about COVID, with the latest COVID variant being nicknamed Kraken XBB.1.5. And essentially the gist of all these articles is going to be, hey, this new variant is somewhere in the world or everywhere in the world, or it's about to enter your country, or it's not yet about to enter your country. Things that are very specific that may be a little lost on people who don't know the molecular virology behind things.
The sort of threshold of information's changed during COVID. So
yeah, that's the one very minor silver lining in all the doom and gloom.
someone's been really excited to name this, I think.
It sounds like a nerd. It sounds like a nerdy scientist, not a polished PR person. Right? It sounds like a nerdy scientist did it. And
I mean, someone's gotten really excited.
really excited.
Yeah.
And look, I'm a nerd. Like, that's great. I would have named it something more.
Yeah, I know.
Nerdy.
Like,
So
you've got to instill some feeling behind it. From reading the article, maybe it sounds a bit more terrifying than it actually is. So,
well, that's the pitch of it, right? So let's break down how new variants are typically presented to people. So they talk about its relationship to another variant or strain that people have heard of recently, say Delta or Omicron, and then it presents this very common thing where it shows, in this case, it talks about mutations. And first of all, people might not know what a mutation necessarily is. Maybe if you read comic books and X-Men, and you kind of get the idea there's like something changing the DNA. They put this kind of naming system. It's a S486P mutation in a specific protein called the spike protein. Right? So there's a letter and a series of numbers and another letter. Now, if I was someone in the general public, that wouldn't make much sense to me at all.
No, it wouldn't.
Right?
I mean, maybe there's a little bit more of an understanding out there, understanding of mutations and what it could mean. In this case, we're talking about a change in the protein that may render the virus more infectious or not able to be detected as well by the immune system or, changes like that. But this article was in The Conversation, was it? Or
yeah, that's right. So it's based on the Conversation. It's got a scary purple diagram of COVID.
The Conversation does tend to delve a little bit more into the science when they're writing the article, because they're choosing usually it's university professors and experts in the field to write these articles. It's
really great, actually. We backtrack a little bit because we don't know who will be listening to this. Hopefully it's professors exclusively, only professors, but
just my boss.
Maybe just your boss or my boss, my boss's boss or our boss's boss.
Yeah, that's
DNA is made up fundamentally of bases, A, T, G, and C, and those bases are configured to form proteins, and proteins are made up of individual amino acids. So when they give you this kind of naming system to say it's S486P, 2 letters represent different amino acids. There's about 20 different variants, depending on how you measure that, of amino acids. So the 486 refers to not like how infectious it is. 486 refers to the position in that sequence. So the 486th amino acid in that string of amino acids has been mutated from an S to a P. So
in that particular protein that they're talking
about.
So
this is very useful for scientists.
Yes.
Right? So we know,
absolutely.
We pinpoint exactly what has changed.
That's right.
But almost completely useless to a news agency, right? That gives you no value judgment on the things people care about, which is it going to be more infectious? Is it going to be more lethal, right? And that doesn't tell you anything about that.
I think if you say a mutation in the spike protein, that that's something that's just quite understandable by the general public. They understand sort of the significance of the spike protein. Delving into the details of the specific amino acid changes is probably not really necessary. What are they saying about the how bad they think this variant will be?
Well, this is where the caveat train arrives, because there's no quicker way than to look like a fool, a very well-educated fool, to go on some kind of online platform to proclaim something about the latest strain of COVID. Either it's the end of the world or it's nothing.
That's
or
right.
You have to do this and do that and whatever. Like that's the quickest way, because the evolutionary pressure on this virus, given that it's spread globally,
that's right,
is so extreme that its pace is just way quicker than anything we can project forwards. And we are just historically, we as in humans are just historically bad at making predictions about any kinds of thing. With that caveat aside, currently it seems like the Kraken is, I think the article says, more bark than bite, I think is the phrasing they use.
Oh, okay.
And that it's not necessarily more infectious than the previous Omicron variant, and it's, in terms of lethality globally, is maybe the same or a little less than the previous variant. I mean, I recently caught COVID. I don't know what variant it is.
So did I, actually.
So it was my second time. The first time I was bedridden for a week, and then all the usual things. We don't rehash this, but I lost my sense of taste and smell for a month. I had a sort of quite debilitating cough for a couple of months. And that was pretty bad. But this time it was kind of like a day and kind of recovered. Yeah. But I'm not, hopefully, in the immune compromised population. You caught it recently as well?
Recently, I had actually had the flu 3 weeks prior. So it was a bit of a shock to the system. I was probably a bit run down. And all of a sudden I had this feeling that something wasn't quite right. I felt like it came on really suddenly out in the in the chilled section of the supermarket and suddenly sort of felt like I was developing those body aches, came straight home and tested myself and immediate positive on my rat test.
Right.
I think I was actually starting to think I wasn't going to catch it because I've managed to evade it so far, but wasn't the case. It was not too bad. Didn't have super high fever. In my case, the influenza was worse. Like you said, I developed a cough as well that just kind of hung around for a long time. I think I was lucky to have not too severe of a case, which is not the case for everyone. So the first time you had COVID was worse.
It was much worse, and I could distinctly tell it was different than other things I've caught, cold, flu.
Yeah.
I'm triple vaxxed. For whatever that's worth at this point.
Yeah,
right?
me too.
And I'm sure it would have been worse if we hadn't been. And also, it's not out of the realm of possibility that we might develop long COVID at some point with lingering symptoms that kind of are unpredictable, because it essentially triggers all sorts of autoimmunity. And I don't think there's a good grasp on exactly what long COVID is, and also how variable it is. Again, we're not in the prediction business in this sphere. It's just so wildly changing.
Yeah,
absolutely. Which brings me back to this idea where the evolutionary pressure on the virus, when it's spread globally, it's not like a local epidemic, it's very much a global pandemic. Right?
Yeah, that's right. I mean, the virus from an evolutionary perspective, I mean, this is more your area of expertise, Jack, wants to be able to spread. If it made people too sick, that would be inhibiting its ability to spread, not in the virus's best interest, so to speak. They were predicting early on, I guess, in the pandemic that it may eventually just kind of mutate itself to a very mild disease. So it'll be interesting to see.
Again, those people are now scalps on the wall of some online blogger. Like, you fool.
I don't know.
All your credentials in education, you made all these wrong predictions.
Yeah.
But essentially, this is what I tell my students all the time. Microbes, whether they be bacterial or pathogens or viruses, they've got no agenda other than just to replicate.
That's right.
But that's their sole agenda. So if anything they're doing compromises that in some way, then natural selection, where the ones that are more favored to spread without killing the host, because if you kill the host,
how's it going to spread?
How's it going to spread? People aren't going to go near a dead person, but they'll get near people on buses and coughs and that kind of stuff. Hopefully this is the eventual shift towards our thinking. Again, who knows? We're not in the prediction business of COVID.
No,
that's a bad business.
I don't want to be.
No.
Don't want to be.
Speaking of poor predictions, let's move on to the next headline, which is around, I guess, the whole healthcare sector, really, but specifically drug companies' ability to predict how much of a drug is going to be in demand. And also how their supply chain can react to sudden fluctuations in demand. Now, normally this is not something that happens too aggressively, because certain conditions and illnesses, they don't really spike unless they're infectious, right? So there were, of course, shortages of the vaccine. There, of course, there were shortages of antivirals and antibiotics, all that kind of stuff. That makes sense. Infectious stuff spreads up and down. But
that's right.
When we're talking about kind of chronic illnesses, things like diabetes, you wouldn't expect there to be a sudden explosion of diabetes and the anti-diabetic drugs to all of a sudden need like a quadruple, tenfold increase in demand, right? Which is exactly what's happened here, where the drug Ozempic, which is a once-a-week injection that people with type 2 diabetes could take as an alternative to insulin, which is very common for type 2 diabetes, because their blood sugar is going to sort of keep going up, and it goes up and down really crazily in response to different things that they eat. Again, insulin has a lot of other crossover effects that are difficult to manage on a day-to-day basis. So some people say Ozempic. Some diabetics say that Ozempic is a much more, once they get used to it, a much more manageable, more stable kind of...
it sounds really good.
So the headline is that there's a huge shortage of this drug. And again, it could be for a number of reasons, but it doesn't appear to be a spike in a number of type 2 diabetics in Australia. So this article was Australian specific, but I believe the shortage extends beyond Australia, right? Because all these...
worldwide, right?
Yeah. Very few of these drug companies are local to Australia.
That's right,
They're all based...
Very few,
US, Europe. Okay, there's a huge shortage, and it's gotten to a point where a number of governing bodies have had to make official announcements about this, right? Like that's when you know it's bad. Like when you got official press releases from in Australia, the TGA, the Therapeutics Goods Administration, TGA, and so this is what they're saying. They're saying the reason that it's a short supply is because of off-label prescriptions. And you work with clinical research and clinical trials, so you probably know this a bit more than me. What do you think they mean by off-label prescription?
So basically prescribed for not what it's indicated to be used for treating, essentially, which my understanding in Australia at least is not. There's no legal issue with off-label prescribing. But I guess you want to keep in mind that perhaps the science or the research behind off-label prescribing may not be as rigorous as for on-label prescribing.
Right, because you have to actually go through the trials, right?
That's right. So it's a case where I think during the clinical trial, they actually saw a secondary effect of weight loss. So something that was seen during its, when it was being trialed for its initial indication for treatment. But now it's just been, I guess, kind of hijacked by social media. Right?
Yeah. Well, I think it's come about because online clout, and they're bragging that they've lost all this weight and the influencer game. I'm also on TikTok. I'm very, very small following, and I couldn't influence a giant drug company supply chain. Let's just lower everybody's expectations here. The thing with TikTok in particular is that you can't predict who's going to see your video. Like the other platforms, there's more of a rhyme or reason to it. Like you kind of know.
Personal experience with that. You mentioned that it's just
so
very unpredictable.
So I made 2 videos back to back on TikTok. They're both about really nerdy specific things for my students. Like they're about how to make a protein gel, right? And to me, I've showed a lot of people, I talk about this at conferences, 2 videos almost identical, and one had 32,000 views, which again is not that much in the big scheme of things, and the other one had 300 views. I just wouldn't budge. But qualitatively, they're identical. Like we've done all these analyses to say, hey, how many cuts are there? Is my face on it too much, or is the music different, or
how long is a TikTok clip?
At that time, there was a limitation of 1 minute. So you can't make it longer than 1 minute, and it's not the CinemaScope 16:9 ratio that we watch our movies in, or 21:9, however you want to see it. It's the 9:16 vertical video, right? And so it's designed to be like on the phone casually. It auto scrolls for you, right? So it goes to the next one for you.
I just think of, a student cramming for their exam. I've only got 1 minute to learn this. Any longer is going to be an issue, but I can dedicate 1 minute to learning this fundamental skill that I'll need in the research laboratory.
But the thing is, like the algorithm rewards rewatchability. So the feature is that you make a loop where the last clip you play is the same as the first clip you play, or the last word you say follows on from, like it's like a palindrome of sorts.
Okay.
So then when you rewatch it, you don't quite notice that it's looping, because it just seems like I'm saying the same sentence, like so you're kind of designed to make essentially a visual and acoustic palindrome, so that in a minute you're watching for like 5 minutes without realizing it.
Right. Okay. I didn't realize that. Okay.
Right. So if you can do that, then I think that's what the algorithm
is tricking you into learning about
exactly.
But a protein
I've had students tell me like that I made like a 10-minute video on PCR, and there was a 1 minute TikTok, and the students I found the 1 minute TikTok more useful. So who knows? Like, this is a brave new world.
Right.
Who knows? All of that's to say, it has just this incredible influence in a very opaque black box way. Like it's reaching people, and fitness or lifestyle influencers have said that this drug going off label has the drastic weight loss. They look and feel great, and then kind of people are either asking the doctors about it more, and or doctors are recommending it more. I'm not sure what combination it is. It would probably be at the GP. Probably a bit of both. The question for me is, there's no laws against it, right? Presumably in this case, it's pretty safe. Otherwise, we'd be hearing not just about the supply shortage, but about all the people who are suffering severe side effects.
Well, I mean, the one thing about being approved for use for whatever indication is that it is known to be safe based on current best research that is known to be safe. And so then an off-label use is sort of an easier segue to make, rather than something that's, you can't just prescribe something that hasn't been approved. I guess the question then becomes, who is the patient base that are being prescribed this? Are we talking about severely overweight patients who have other chronic health issues and need this? Are we talking about people who don't really need the drug and are sort of trying to get their hands on it for weight loss?
Yeah, and the closest parallel I can think of, which is on a different level, but it's the whole gluten-free craze, right? Where there are genuine people who are celiac, who, if they have gluten, their whole insides get inflamed, and they just feel terrible, and they just legitimately can't do it. Versus those of us who maybe like to eat gluten-free breads or gluten-free things, because we just feel like a little less bloaty, a little bit more energetic, and it's a little healthier. And if you really want to dive into the weeds in that area of clinical diagnosis, pretty much after Crohn's and celiac, which is like a very specific serotype-based diagnostic tests, all of the other misery that is irritable bowel syndrome and irritable bowel disease is really hard to reproducibly diagnose, right?
Yeah, it's its own kind of worms.
So it's a huge can of worms, and people with all sorts of legitimate gut issues, they can't get a proper diagnosis for it, and they find that eating gluten-free exclusively or going pure vegan or going full paleo, that's kind of fixed a lot of the issues that they're facing day to day. But then if the supply chain isn't there to mass produce gluten-free goods, which I think it is very much.
It's very much.
Very much so.
Yeah.
Very much so. Because I mean, there's money to be made, right? So it makes sense.
Yeah, that's right. So much more than there used to be.
There's a lag, but there have been a few years where people with celiac diagnosable gut issues who can't eat gluten were really suffering.
I had a close friend growing up who was celiac, and just the availability of goods is so different to what's available now. I mean, you can go and buy a gluten-free donut. That wasn't a thing.
Yeah, it's everywhere, right? That's a new chain that popped up in Australia.
Gluten-free bread wasn't that widely available. Lunches were rice cakes. Corn thins were a new addition. A couple. That was the exciting new addition to the sandwich realm.
This is a supermarket-based problem, right?
That's right.
Whereas we're talking about like a clinical problem with like prescription drugs
more on a severe scale,
for chronic illnesses. So at the end of the day, there's no legislating around this. Drug companies and big pharma are always criticized for their greedy capitalistic mindset.
It sounds like they just can't keep up in this stage.
So in this case, the capitalism and the need should be aligned.
Yeah.
But then they can't make those roads merge. So hopefully
it's back to hard to predict TikTok, right? But there are advertising regulations that in Australia you can't advertise prescription medication. So I don't know how much is being cracked down on Australian influencers, or I don't know. I don't know. It's a worldwide thing that seems to be going on, and people who want to find information on the internet are going to find it. I mean,
yes, and I'd be very surprised.
Not going to make much of a difference in this case.
Be very surprised if our advertising legislation can keep up with TikTok. as well,
exactly.
Right?
It's just not feasible.
Yeah, and the monetization there is just. I think initially no one on TikTok was making any money.
Okay, yeah.
And then people who were big on TikTok, because they could make those loop videos very effectively, the only way that they could get money from that was to try and move them over to YouTube with a clearer, more transparent monetization policy. That's a hard thing to do, right? Yeah. Now I think every platform, Instagram, TikTok, and YouTube, once you have a certain amount of following, you can get some monetization from it. So then that's definitely advertising. But
I think the health and wellness space is huge in, TikTok, YouTube, Instagram. So regulations on these, sponsored products or gifted products and recommendations.
Sure.
And I think that's been cracked down on in Australia. I mean, I think I recently saw sunscreen was a bit of an issue. So, say beauty influencers who were gifted sunscreens to test and give their opinion on were technically not allowed to do that anymore because it was considered that they were paid in some way for their promotion or review of the product.
No, all I'm hearing when you're telling me that is just a criticism of the genre of video I make, because I'm not getting any of this free sunscreen. I'm not getting in any trouble with the regulators. I'm not on anyone's radar. So I'm clearly making the wrong videos. The health and wellness is going to be the 2024 thing.
It's all in the protein powders and the...
Yeah, no one's going to take lessons from me. I'm sorry. I'm going to know my lane. Yeah, I'm going to know my lane.
No one's gifting you any sunscreen.
Yes. So the drug companies clearly, again, their capitalistic agenda or moral agenda is aligned with the demand in this case. And it seems like the side effects are very manageable, whether it be diabetics or weight loss. So it should be a feel-good story, right? This should have been like, hey, drug companies making this drug that has multiple purposes.
Yeah, it's great.
It should be a great
type
story.
2 diabetes. It can help with weight loss.
But then it's now pitched as a zero-sum game of diabetics against people with body image issues, and the drug companies making money from everyone, but not enough money. But how much money is too much money? It's just like it's a huge mess, right? Yeah, which comes to the idea that no one really knows anything, and it's really hard to make these predictions. Yeah.
I thought I saw that a higher dose is actually, I think in the US, approved under a different name for treatment for weight loss. But I think that's not the case in Australia. So
the US regulatory environment is the wild west.
That's right.
But
Yeah.
But often once you have FDA, then everything kind of
And so,
falls
yeah, in
backwards.
this case, actually the same drug, just at a high dose. So.
But I think Australia is well renowned for its very strict regulatory environment. I think that's the perception. Whether it is for your specific area of work, I'm not sure, or anyone else's area of work, but that's the perception we have. I think that's a good perception to have. I guess if you were a drug entrepreneur, not a drug dealer, I guess that's going to make you. If you're an entrepreneur in the drug space, let's say, then maybe Australia isn't a market you want to crack into because it's
I'll
like
write
not
that
that
on one of my next
drug entrepreneur.
paperwork.
So if you're a drug entrepreneur, maybe this
Yeah.
strict regulatory environment isn't to your advantage, but really for the consumer, it should be.
Yeah.
But in this case, it seems like all the
Right.
wires across. Yeah.
You know, when I go through the airport, I actually put researcher or government employee or, you know,
do you? Is that
something
what you
like
said?
Yeah, on my forms, because I'm a little bit scared that if I write scientist, I'm going to be pulled out for some kind of drug screening.
Yeah, sure. That makes sense.
I don't know if it's a strange paranoia to have, but
It's
yeah,
weird 'cause
researcher I think is the one I normally,
Right. 'Cause when I was younger, I was very insecure about what to say. And because when you say scientist, the follow-up question is always like, on what? And
That's right.
That's the fear every PhD student has, having to explain what they research, right? So I was like
and you're
paranoid.
going, do you have 2 hours?
Yes, and it's like you straight away start hating yourself because you don't care about what you do enough to explain to make someone else care about
That's
it.
right.
So you
it
just
takes too
know
long to make them care
so
about
what
it.
I think I defaulted to saying because like molecular biology or microbiology.
Oh, okay. Yeah, that's quite specific.
That's pretty specific, right? I think at some point I just kind of just said biology. Or I think I said cancer at one point because one of the things I was studying was very vaguely related to cancer.
Yeah.
Now that I'm teaching, it's a little easier to communicate, right? So
Yeah, that's right. That
Professor,
one's easy.
teacher is a little easier, but yeah.
Yeah. I also have this sort of secret fear that I'll have some kind of chemicals from the lab on my clothes that haven't washed out that they're going to pick up in the drug screening test.
Oh,
I don't know.
Yeah. I mean, the stuff we work with is highly flammable, but
Yeah, just I don't know.
but hopefully you're showering regularly. To the
Yeah,
point where
well,
you're not
you'll be pleased to know. Hopefully you can smell that I've been showering regularly.
Okay,
but,
not from here. We're socially
not from there. You're far enough
socially
away, so
distanced
that's okay. We should probably move on to the next
All right. So speaking of making poor predictions,
Yes.
and big entities unable to keep up, brings me to the next segment, which we've very glibly named "Whose Job Is It Anyway?", which is our recurring segment, hopefully recurring segment on changes in the employability sector around, again, science, tech, and education. So this is the article, but really it's a whole series of articles. There's 3 that all kind of talk about the same thing. And the first one is CNET, which is, depending on your mileage, you may read regularly or you may not. They are a large online sort of conglomerate publication. They talk about technology news a lot. And very recently, last week, I don't know when I'll edit this, but so in mid-January 2023, they found out that a bunch of articles that they released in late 2022 were all written by artificial intelligence in the first instance. But essentially, they used the AI chatbot to answer very specific questions about the topic of those articles. And I think it was talking about financial instruments that were moving very quickly.
Pretty
and
complicated.
It was super high and then super low, and it was really complicated. So I think they smartly, used the productivity tool in AI to help them do the initial research.
Yeah.
And then rigorously fact-checked is what they said. Rigorously, a team of humans rigorously
fact-checked.
which I think is interesting, but also, it's scary, right? But I think you kind of have to disclose that, right?
I think it should definitely be disclosed.
Yeah, because this article's from Engadget, but also other big online platforms like The Verge. And it was a reporter, hey, we're paying our human employees to write these tech stories, but CNET, our competitor, presumably, is just using AI and not even disclosing that it's AI, right?
Yeah.
CNET is using AI to write financial explainers nearly 75 times since November. So that's just November 2020.
75 times.
75 articles since November. So, hey.
And they're all, finance and complicated, or complicated to us.
Definitely. So we're not in the finance space.
No, not at all.
Right?
Not at all.
Because if we were, we would not be in this business because it doesn't make any financial sense in any respect. But this is just the articles that they've found out so far, right? And that's not to say.
Yeah, that's right.
And these are like public-facing artifacts of work, right? What they use AI, but who's to say like more internal workflows haven't been automated? Like this is like the most public.
Whose decision it was to start doing this?
Because recently ChatGPT is the is the version of AI that everyone's talking about right now. And it comes from OpenAI. Yeah, so they're the company that have investors from all over the place, including Elon Musk and Microsoft, right? So they're like 2 agents with seemingly wildly different dispositions. So Elon is very unpredictable and Microsoft is very kind of historically stable. They're aligned with big business, big enterprises. Their software is designed to be used by professionals in very reliable, predictable ways. So the fact that they're both heavily invested, with Microsoft being one of the biggest.
There's something to it, clearly.
I think the deal that's not yet finalized is like 10 billion or something investment out of a 29 billion valuation of OpenAI. Big money, big business. All of these people are thinking this is essentially the next big thing in technology, right? The thing that you realize when you first use it is that there's no fancy anything. It's just you log on, you sign up, and then you type your question into a box and it comes back and gives you
because I have to admit I haven't had a play with ChatGPT. I've heard things about it, but I haven't really.
If you see any new app, they try to get you with the bright colors and the sound effects and that kind of stuff, but they've gone the opposite route. It's just very unassuming.
It's like an old school chat room. Okay.
Literally just a chat room. And the other thing is that it's way different than how AI has been depicted up until this point, right? If you ever saw that movie Ex Machina, which is like a crazy movie, right? So
yeah, I have seen it a long time ago.
Yeah, so I mean, they got Alicia Vikander to play the manifestation of AI, which fooled everyone. Spoiler, fooled everyone in the movie that she.
Spoiler alert.
The scary part wasn't that she was good at hiding that she was not human. The scary part was that even when it was very obvious that she wasn't human, it would still able to convince humans to do their bidding, right?
That's right.
To convince them to sympathize with them. And one of the characters will let her escape that.
That's right, yeah.
Robots or like lines of code, but this is not that at all. It's just like a blank screen with
an interface.
With little interface. That's kind of why it's so appealing. I think they've gone that really interesting way.
Of course. Yeah. Is this something you suspect they've used something like ChatGPT to prompt it, write an article about? This particular topic.
So the easiest way I recommend for anyone listening to this is just go have a play with it. At the moment, we're in January 2023. It's free, although it's frequently crashing because of the number of users. It's the fastest platform ever to reach 1 million users.
Oh, wow.
Ever. The fact that they're so accessible would mean that people were able to use it and we're testing it. And in this case, CNET has been co-opting it as part of its professional workflow and hopefully not replacing writers in writers' jobs, but enhancing their productivity on their behalf. Where it's going to come in is not where anyone predicted AI would come in to take people's jobs. The paradigm shift that I was always taught was that when automation comes in, it's going to be the blue collar jobs that have hands-on repeatable skills that would be automated away with robots.
Right.
If you're a white-collar job or an intellectual or a cognitively demanding kind of role that you're doing, you're analyzing things, you're thinking about things, maybe automated away, but that takes a high level.
Parts of it anyway.
Yeah, that's right. But that has a high level of sophistication. And if you're an independent artist who's creating music and art and poems, that sense of ineffable sort of spark will never be replaced, right? So that's how it was always pitched to me, but it's gone exactly the inverse of that trend where DALL-E 2 is up to the second version now, where you just ask it for photorealistic images and it creates brand new artwork from scratch, right? And you can ask it to write poems. I've asked it to write, it's not a very good poem, but maybe that's my prompt.
I don't think I'd be a good judge of that. So
no. And you can ask it to compose music for you in a certain mood.
Oh, right.
Like write me a classical acoustic piece in the style of this person. Can you give me a graphic that communicates melancholy in the style of 8-bit sort of sprite characters, like, so you can be pretty specific with it, and then it gives you like presumably original art, right? Like new pieces of art. So people who work in the areas of, let's say, photography or visual artists or graphic designers whose job it is to make custom graphics and get paid well to do it, because that's a creative task that's very difficult to replace seemingly overnight. It was being talked about as well, why do we need to have a graphic designer or a visual artist?
No, and I never would have predicted that would be the kind of field that you'd see encroached upon by AI.
No,
never in a million years.
Not at all. And it's crazy that's the first thing it came for.
Have you played with it to generate art? Or?
Yeah, I've played a lot with it. Certain aspects of it are really impressive, especially when you give it a prompt. I think you say, give me a 3D render or give me a photorealistic image. If you give it those prompts, then it will create something custom. Most of them look absolutely crazy. Like,
Right, I was going to ask, does it look like something where you went, what is this? Or, I mean,
yes.
some art is like that.
Yeah, well, that's the thing. Like,
it's
who
all
am I to judge
in the eye of the beholder.
But let's say you were writing an article written by AI. So you work for a publication that hypothetically uses AI to write its articles, and halfway through the article you say, well, I want a stock image here to represent how people are feeling stressed financially. Right, so let's say it's about a financial instrument. I want to know more about it. I want a stock image of someone who's short on money or feeling stressed about money. And you can go to the big players like Adobe Stock and look for one and pay for that fee to use the image. You can go out there and hire a photographer to do something in studio. Or now apparently you can ask AI to, hey, give me an image of a person feeling stressed about money, and it'll give you something that will communicate that in some way, right? So how it's been tuned is really interesting, right? Because I guess of all the things to release, they could have released, it turns out OpenAI has all of these tricks in its bag, right? All of these different elements of it. But that's the thing they chose to release first. Well, that's what everyone heard of first anyway. Like the fact that it's,
isn't it?
It's the creative element that can be automated away as a kind of a proof of principle, as a bit of a flex, right? To kind of prove that the paradigm shift is reversed and all of your predictions about automation are wrong. There are some seams that are showing now because a lot of artists are finding that their art is being used as inspiration, let's say, for the AI generated art. And in many cases, if people have a watermark on their work or a signature.
I saw this, and there were sort of remnants of that still on the AI generated images.
Yeah, or like just consistently the bottom right corner of these images is like blocked away or replaced with something, right? So how much it's taking creative license and how much it's just straight out plagiarizing visually is very unclear. And there's a lot of artists who are basically finding that their artwork is used to
terrible for them.
Certainly train the AI. Whether or not the AI is spitting just that artwork back is a different story. Yeah.
But part of their work is generating something unique and interesting, and then just to have that heavily leaned upon.
How could this affect, let's say, your job, right? So you work managing clinical research, not to give your boss any ideas to automate your job away, but you have to think creatively, right? Like, so can you use this technology to make you more efficient? Or are there aspects of your job that you should think about delegating because it will be automated? And if you're spending a lot of effort on that and not learning new things that may be a little harder to automate or can't be automated, maybe that's a better use of your time and better use of resources, right? So are there any aspects of your job that you think fit into this scheme?
I guess the writing is an interesting point, whether you could have it say, I don't know, write an article or write an application. People with science backgrounds, we know that you have to take everything with a grain of salt. I would be very, very worried that it would pull from something that was not reliable information to make certain conclusions. I think I don't personally have major ethical issues with its use, provided it's done in the right way and it's rigorously fact checked.
Right.
Or used as at a very baseline level to start something. But it's scary. It's scary.
It's scary. And in my area of assessment and students and the temptation to use it to quote unquote cheat is through the roof. Now, assuming that it stays free for the next semester at least, then students can access it. And I don't think the plagiarism checkers right now are anywhere near as advanced as, because it's generative, right? So what it does is it creates a word and then it uses the previous words to predict what the next words would be. So it's not like spitting out some kind of pre-written thing. It's the natural language model, as they say, right? So the AI is using your keywords and thinking of the first word and then using that word and your prompt to predict what the next series of words are, like a human would to conceive language when they're thinking of a sentence to say, right? So that generative model of text doesn't actually give you reproducible pre-written sections that consistently. So if you put that through the classical plagiarism checker, it wouldn't be able to detect that.
Right, not at all.
Consistently, not to say there aren't other ways of checking it, right? I've put a few of my exam questions through it to see what it comes up with.
Oh, have you? That's interesting.
And
how did it go?
It's great for breadth in terms of the coverage of lots of different topics. Like everything it's saying is on point, right? So relevance seems to be what it's tuned for right now. Hey, here are all the things that might be relevant, but we know that that's not enough, right? Like you have to then build on top of those topics or choose a subset of those to then invest a bit more of your time and focus on your work and research.
Of course.
But really when I'm grading papers and I'm grading exams, like breadth might be all I can afford to grade students on at a certain level. Maybe asking them to think more at a higher plane with more complexity and constructing new understanding. Maybe that's the most asked for like a first year student in uni or
Yeah,
college.
of course. It's a scary thought, isn't it?
Yeah, it's scary. So I have no idea what I'm going to tell my students about it this semester. I think I have to say something about it.
Yeah, it's good to acknowledge it.
But if you want to do this for 1,000 students, the design assessment, that can't be
So
beatable by
hard,
AI.
I imagine.
Very, very unfeasible. Right? It's not scalable. Speaking of not scalable, Amazon has cut 18,000 or more jobs and anticipated to cut around that number. And the nature of the types of jobs that they're cutting is interesting because, again, if you're watching this and you're a student, like we have jobs and we're contemplating the impact tech and AI is going to have on our jobs. But if you don't yet have a job, I don't know how you're supposed to feel. Are you supposed to feel
What do you do?
Are you supposed to feel motivated by it? I don't really know. Like what are you doing? What have you like in the final year of a degree that is very easy to automate, which I don't know what that would be. What Amazon is saying is that they're cutting about 6% of their workforce, of their 300,000 person corporate workforce.
Corporate, okay.
Right, so they're saying that it's within corporate. I don't think that's necessarily within their warehouses, with their shipping, although they do have a lot of attempts to automate that part of the process as well. But again, it's different, isn't it? It's like it's not at the quote unquote lower end of the labor market, the blue collar hands-on side. Maybe it's just the components of building robots are more expensive and you have to have sort of ROIs.
I don't know. So are they indicating this is due to automation at that upper level or?
Well, I mean, there's a looming recession and not a full-on recession.
Well, that's right. But then, I mean, and I'm no economist, but I would kind of assume that would affect all aspects of the business rather than one particular section. If people are overall purchasing less products, or you'd expect that to sort of hit at the warehouse end.
So that's really curious. Surely they would have played with their in-house version of AI long before ChatGPT, right? And they would
assume so.
And they would have access to this kind of stuff, and maybe they saw the writing and said, well, if we can automate away, say, well, here's 6% of the corporate workforce.
Yeah, you wonder what it's secretly influencing, don't you?
Much of the conversation in my area has been like, hey, students will use this to cheat. That's not the risk here, right? The risk is big enterprises will use the system to cheat. And by cheat, I mean just become business as usual. And then that affects everyone and everything.
That's right.
Whereas students, if they're doing it, then they're probably costing themselves something in the long term, because then the value of their work is zero. Right? If it can be automated, the value of their work and the value of their intelligence is net zero. So it's of course not just Amazon. I mean, Twitter famously, or the Twitter's own kettle of fish is going through some crazy ups and downs. So it's fired 11,000-ish. Numbers are very unclear. It's its own kettle of fish. Facebook, through its metaverse, through its VR goggles, they're hemorrhaging and they're like a lot of stuff as well. Is that tied to the fact they're losing money, or is that tied to the fact that automation is coming and AI can do a lot of the tasks that they're predicting to do? It's a really, really quickly moving landscape.
I was going to say, just back on that student aspect, we have to remember that as this becomes more commonplace, it's going to be used by people in their jobs as well. So, I mean, we need to be thinking about, in my humble opinion, working around it and how it may be used in everyday life. Things is important. So this is something that will probably, as time goes on, be embraced more. So we should think about how it will be used and working around that in terms of examination. And
I want to have first mover advantage, right? So I've already started using it in my workflow when I can access it. It's always offline because there's so many people on it.
I'm going to need to get onto it.
The thing that it's trained and tuned to do currently is to try and convince you that it's human, right? Convince you that it's able to come up with original things, and it does that by connecting to as many people as possible in different genres. And so that's essentially a PR person, really, right? And that's the thing I have the biggest trouble with in my job, because I explain a difficult concept to a first year student versus a third year student versus a very highly intelligent and maybe a little bit of jaded medical student or a PhD student, right? It's like all these different things, right?
Different categories.
And then so sometimes I have a day where I've got 6 hours of classes, and every single hour is to a completely different type of student.
Right.
and it could be on very similar topics or completely different topics, and my brain is just fried after half of that because I've had to modulate it so often. And so if there's any part of this that I can ask AI to help me set up the framework or the parameters of this new target demographic, that would really help. And in terms of things like making YouTube videos, thumbnails that are attention grabbing, like what needs to be in it about this topic, or a video title, like how do you design a thing to have maximum reach and convince as many people that it's worth their time? I mean, I think that's currently what the algorithm is tuned towards, right?
Yeah.
It's in that phase of the rollout where it needs to convince people that it can do the thing and break through the connections, right? And also it can write code amazingly. Like you can ask it to write scripts for anything.
It's actually amazing in my field.
Yeah, so
in terms of automation of
automate this analysis for me, or
analysis. Yeah,
or
fantastic.
Set up my out of
Because that is a very laborious part of scientist jobs. So I mean, that aspect is fantastic.
And not every scientist is a computer scientist or
Not
a software engineer, right? So coding is
acquired skill for sure.
It's an acquired skill, yeah. So really, really quickly moving, which brings me to our last segment of our first episode, episode 1, which is crossover of the week. ChatGPT can be used to detect early Alzheimer's. And the idea here is that part of the diagnosis of Alzheimer's is around speech patterns, speech behavior, like the pauses, the intonations, and essentially some early work has shown that if you take the transcripts of people who are suspected of being in early onset dementia or Alzheimer's, coupled with recordings of what they're saying, and you submit it and you give it to a tuned version of AI, they could basically predict and confirm the Alzheimer's diagnosis through the more official diagnosis pipeline, right? Because when you train a data set, you got to know whether it's a false positive or a false negative or a true test result of being positive for that disease or illness. The hit rate was 80%. So they get it accurately predicting whether this person has Alzheimer's based on transcripts of what they're saying and recordings of what they're saying 80% of the time, right?
Interesting. Okay.
So this hits everything. So it's not just the tech, it's not just productivity, it's really clinical research. And the companion piece to this is that people are using AI to pass the medical licensing entrancing exam to US. And I think it's not like an amazing super high tier score, but it's enough to pass. So it's cognitively able to respond to all of these clinical scenarios that they throw these people in. Some accelerated use of it within our context of like healthcare and biomedical medical research, right?
I think it's fantastic, actually. You know, healthcare access can be a massive issue. So if someone is able to routinely have this test, then they're not having to go and see their GP or specialist or, you know, and they're able to access this kind of thing. I think that's great, especially in terms of preventative health and early diagnosis. I think it has some fantastic implications.
So more accurate than WebMD or something like that, right? Yeah. Supercharged version of WebMD.
We've all been on it.
Supercharged WebMD, yeah. I guess my question, again, not being in that field, is 80% positive diagnosis. Is that a good figure? Because in my area, that's not.
You know, even if it's for an early indication of something that, you know, maybe you don't want it to be the be all and end all of testing, but as an indicator or as some kind of pre-test that someone may take to decide whether they need to follow up and have further testing done, then it's quite powerful from that aspect.
And it depends on the stakes of that test result, right? What are the outcomes? What's the risk profile? So we talk about false positives and false negatives all the time.
Right,
So what does that mean?
False positive is when you get a test result that indicates something that's not actually the real result. You know, a common example may be, say, a COVID rat test coming up with the positives for having COVID when you may not have it. I think that's actually quite rare in the case of the COVID testing. A false negative is much more common in that case. And a false negative is when you're testing and seeing that you don't have a particular condition or result when it should actually be positive for it.
Right. You want a true positive or a true negative.
That's
right. You don't want a false positive.
We call them internal controls that we would use in an experiment to test this kind of thing.
When we do our testing, the gold standard for diagnosing, let's say, a pathogen, you want like 95 to 98%, right?
From a molecular perspective.
Because let's say it's a false positive and you said, hey, you do have Alzheimer's.
Right.
The first thing you would do is, well, let's go and do more testing, right? So that's not a bad thing. And let's say if it's a false negative, then that's maybe where the there's a bit more of
where
a
the
risk.
risk lies.
But
Both obviously you would not want to have, but personally I would rather have a false positive, do some follow-up testing and make sure you're capturing the whole at-risk population.
Okay, yeah, sure. Oh,
even
great.
though it's not fantastic.
No,
obviously.
it's not fantastic.
You know, one wants to be told something they have some disease that they don't have, but if it prompts further testing and then you go from there, I'd rather capture the population at risk.
Oh, you're so pragmatic. I'd rather be in denial, to be
Would
honest.
you?
I'd rather
Okay.
not know at all. No, well, obviously managing it, you want to know, but
neither situation is great.
But again, we're talking about like talking to WebMD or just typing into Google and then it gives you a diagnosis. That's pretty good.
I could see how maybe it would then form part of routine testing. You know, once a year you sit down, you have a conversation with this interface and it sends some updated health information to your GP for follow-up or not, and just becomes sort of part of a screening to detect at-risk individuals. So I think from that perspective, it could be quite powerful. But yeah, again, I wouldn't want anything AI as the sole diagnostic tool. The dirty secret is that a lot of scientists just hate new technology. They don't trust it. They have trust issues.
Right, because they know that innovation within their own field is so kind of on a knife's edge. Right?
Yeah, it's exciting in some aspects, but we can be superstitious.
We've gone on long enough, I think, for our first episode. For those of you listening, this should be on all the podcasting platforms. It'll be on all the feeds across any podcast player of choice. We are filming this for YouTube, so if you're watching this on YouTube, it will be there as well. This is a rather new venture. This is literally episode 1, so hopefully our aim is to do this every 2 weeks. And eventually, if we see that it's productive for us learning about these news articles, we might do it up at the weekly, but that's kind of the release schedule we're aiming for. Statistically speaking, if we make it past episode 7, Amanda.
Oh,
if we
I love some stats.
Right, so
go on.
Apparently, most podcasts die and they fail.
Okay.
Okay, so
All
we're
right.
really optimistic
7.
here. And 7 is the average number of episodes you make before you realize, hey, this is not worth my time, right? So if we make it to episode 8, we should have a little mini celebration because we've clearly found a way of making it sustainable and found some value in it.
Even if it's just for us.
Hopefully, anyone who's listening finds value in it for them as well. I'm Jack Wang.
I'm Amanda.
This is Crossover Connections, and we'll see you and connect with you at the next episode.